I'm Paula Nutting, your musculoskeletal specialist, and I've had a couple of therapists out there that have asked me about manoeuvres that I use for people with arthritis, specifically elbow and radiation from elbow arthritis. Very interestingly, the old techniques that we used to use, which was a lot of cross-fibering over tendons, are not so applicable anymore. A wonderful researcher in fascia and scar adhesions, Susan Chappell, who lives in Squamish in Canada, talks about actually pulling the skin. So we're lifting up, we're elevating up the skin, and we're actually mobilizing the nerves, which are the real reason for the pain, and assisting to give some volume between the elbow joint and the surrounding structures. This is really good for tendinopathies, the tennis elbow, golfer's elbow, but we also use it for a lot of people who have got arthritis, just to give a little bit more neural safety in through the area. The other things that we're going to do with joints is we're going to really assess if it is arthritis, because arthritis will give you heat, swelling, in cold weather that they feel more uncomfortable. So we want to get good history to see if it is arthritis or whether it's just tight attachments from our triceps, our biceps, or some of our forearm flexors and extensors. And we can do great work if it's simply something like that. So looking at triceps, we can use that same active movement. So I'm going to be gliding my thumb up Liana's tricep while she's going to go into extension and then flexion. So you're going to come along like that, and I'm going to glide my thumbs up and glide my thumbs up. So we're just going to hold it there. Come across a little further so that you can actually see. So we're going to glide. See, my thumbs are going towards the posterior deltoid. How's that feel?
Yeah, good. Doesn't hurt.
Yeah. It shouldn't feel too uncomfortable. You get a lot of clients that come to see you. They're age-related arthritis a lot of times, so you don't want to be too heavy-handed. The same with the biceps. We can get her into flexion and then extension, and I'm drawing up with my fingers, and again, right on that tendon attachment. So we're catching the tendon and the muscle belly. One more time. Good. And relax. And then the last thing we can do is just fingers across our medial and lateral epicondyles, and just giving that joint a little bit of mobilization, a little bit of rotation, a little bit of rocking. Coming down to the wrist, a little bit of flexion, a little bit of rocking. So we're taking a thumb on the ulna, thumb on the radius, and we're pressing and pressing. So we're actually trying to do a little bit of a glide like that. This is all pain related. If they're uncomfortable in this move, you want to be really quite gentle with it. And then lastly, we're going to assist by gliding all the way down through the webs. And it's all about trying to open up the joint spaces for your clients and patients, to give them a little bit more flexibility through each of those joints. How's it feel?
Yeah, it's nice. It doesn't hurt when you're doing anything. It doesn't pinch or anything like that. I'm not getting shooting pains.
Where it was earlier, wasn't it?
Yeah. All through here.
That's great. So tricep active glides, biceps tendon and muscle belly active glides, rocking and rotating through the epicondyles, down to the wrist joints and through the fingers. Try that for the next client that you've got that comes in complaining of arthritis, and see how you go. I'm Paula Nutting, your musculoskeletal specialist.